Hello, my name is Enrique, and today we're going to have a discussion about tumors. Now, sometimes tumors can be a very scary word, and there are parts of it that can be very scary, but there's other parts that maybe just require for us to watch them. So, what is a tumor? A tumor is when cells in the body grow abnormally. They're just changed, they're just different than a normal cell. So, that's what a tumor is, but there's two types of tumors. And you might be familiar with these terms, and one of them is called benign and one is called malignant. Benign, it we should watch it and be cautious of it. And the other one is called malignant, which can be a very, very scary word, as we're going to explain as we go through. So let's first talk about the one of concern, and it's called a benign tumor. Um, let's talk about the growth of the benign tumor. A benign tumor usually grows very slowly and it's not very aggressive for the most part. Second, it's invasive. What that means is that it usually doesn't affect the other connecting tissues around it. It's usually encapsulated in one certain area. Now, the treatment for benign tumors is that usually, sometimes we don't do anything about them. We just watch them and make sure that they're not changing in any form or fashion. Because again, they're encapsulated, they're in a localized area. Sometimes they do require excision or for them to take it out, cut it out when it's pushing on a nerve or creating some type of pain. The prognosis for benign tumors is usually pretty good because, again, it's contained and doesn't spread out. So sometimes it just requires, as we've already mentioned, just for it to be watched. And examples of some type of benign tumors are like lymphomas. That's usually like a fatty tissue growing in somewhere in your body, or it could mean fibroids inside a woman's uterus. So the best thing now. So again, these are not bad, or they're areas of concern. Now the ones. Let's talk about the ones that are absolutely scary, and these are called the malignant ones. The malignant ones kind of grow very aggressively and can spread very, very quickly. So that brings us to a term when we're talking about malignant tumors. It's called metastasis. And what that means is that the tumor begins to grow and it spreads to other parts of the body, which is not good for us. Oh, I should go back and say that a malignant tumor is also known as a cancerous tumor. So the treatment for the cancerous or malignant tumors needs to be very, very aggressive. And it could mean chemotherapy, it could mean surgery, it could mean just an aggressive type of treatment because it could spread so rapidly. The behavior of these tumors is so aggressive that they even sometimes make their own blood supply so they could continue to grow. Now, how do we evaluate tumors in general? The way we evaluate them is there's two ways we do that. One is by grading, and the second one is by staging. So grading, let's talk about that. They take a piece of the tissue and they look at it underneath a microscope and compare how different or how the same it is to a normal cell. The more abnormal it looks, the higher the grade. Now, the other term is probably the one that we're most familiar with. It's called staging. And what staging means is stage one is usually it's localized, while stage four, which is the one that really can scare us, is the one where it's actually starting to spread throughout the body, either through the bloodstream or through the lymphatic system. So, why all of this matters? All of this matters because it's important for us to do our screenings. If you're a woman, you should be doing your breast exams, mammograms, etc., checking for lumps and making sure you're communicating to your healthcare provider. For men, looking at your symptoms, your urinary symptoms, if you're having problems, it's good to have your PSA done every year. And these blood levels will determine whether or not we may be in the beginning stages or some type of treatment may be required. So when we put it all together, the important thing is look at the type of tumor. Remember we mentioned the the ones that aren't so scary, the benign tumor, and then we have the malignant tumor. But either way, it's good for us to get early in the treatment and find out which one it is so we can do the proper treatment. I hope this has been enlightening, and I hope you the best of health. Thank you.